students K through 12 will be going back wearing masks in the classroom. And this comes as fears of the Delta variant we've been talking about, they're ramping up in some states. But what is going to happen in the fall and in the winter? Here to discuss further is emergency room physician Dr. Richard McCormick. Dr. McCormick, thank you very much for joining us. I wanted to ask first about when it comes to masks and masking up our children. From what I read, there's only been one study on the matter, and the result, the finding, was inconclusive. So what is the evidence that masks even help when it comes to our children and are needed?
Right. So that's exactly right. It is inconclusive because children don't wear masks correctly. You're certainly going to let them eat at lunchtime. Anybody who's been around children, I have a bunch of children also, anybody who sees children eat around each other, they're next to each other, they're talking, they're handling each other's food. They're going to put their mask down next to their food. Everybody's going to be touching things. It's going to probably be a good way to spread the disease, quite frankly. The only way that this mask really works is in a controlled environment where you have people who actually know what they're doing, that are being exposed to somebody who's obviously infected. That's where the mask really comes into play. But in a school setting, I just don't see the benefit.
Yeah, let me ask you about this, because I'm a parent. My girls have been vaccinated, and they're still supposed to wear masks. We've seen our school district, all kids are supposed to wear masks. And I wanted to ask you, is this different? I mean, is this Delta variant? I don't want to be flippant about it, because it does appear that it affects younger people more than the previous version or variant did. But is this the right approach to deal with it?
I don't think it is. I'm a big proponent of vaccinations, which I've stated obviously several times on your show, but I'm not a big proponent of mandates, and here's why. Having a vaccination for somebody who's young and healthy doesn't have any lack of risk. I mean, it has a risk. People can get blood clots. People can get endocarditis, myocarditis, this heart inflammation. We don't know what the long-term effects are going to be on children. To anybody who has, especially children who have antibodies, we don't want to test every single child, but if they've already been exposed and have antibodies, they can have a hyperimmune response, which could really be harmful to that child. Meanwhile, they're already immune. So why are we exposing somebody to something that may not even benefit them, but actually may cause harm, when we really don't know the long-term consequences? Once again, I think it should be up to each parent making individual assessments of what's best for their children based on their doctor's advice, and going that route, because that is the safest and most American thing to do.
Yeah, here's what Dr. Fauci had to say about supporting vaccine mandates.
If that's the case, you're going to see the empowerment of local enterprises giving mandates. That could be colleges, universities, places of business, a whole variety, and I strongly support that.
Yeah, but Dr. McCormick, the CDC reports that for the week of July 31st, the rate of hospitalization with COVID for children 5 to 17 was 0.5 per 100,000. That would amount to about 250 children.
Right, and then you compare that to an average year of influenza and how many children are getting sick and die of it. It's really not even alarming as an influenza outbreak. Now,